Hey, thanks for checking out the video. If you all like it, please like and subscribe, and hope you all enjoy it. Have a great rest of the day.
So I'm portraying a ship surgeon from the early 18th century, and some different tools of the trade I have here include an amputation set. Everything's a little messy right now because we just had a rainstorm. This is a capital saw, which is used for amputating limbs, and gonna have to get this string off. So you are going to use this for your larger limbs. For smaller limbs, you're going to use a metacarpal saw. This is for fingers and toes. These are sort of your iconic colonial tools that people who come to reenactments want to see. Also, this is a muscle knife that will help with the actual cutting through muscle and tendons. So some different other tools. When an amputation happens, they will tie off a vein with what's called a tenaculum to help stop the bleeding. They have an assortment of different lancets that are used for making incisions, tweezers for pulling out debris, forceps for pulling out musket balls or pistol balls. For teeth, we've got what's called the tooth key. It's actually probably a little late for this era that I'm doing. This is a tooth yanker. This is a goat's foot elevator, which helps dig out teeth. This is a fleam for bloodletting. Back then the belief was that bleeding would get rid of your bad humors. So I'd have a little bowl like this, and I'd either have a straight fleam or curved fleam, and possibly also one of these kind of switchblade looking fleams. These tend to be more veterinary though. And you would allegedly be able to cure someone of their bad illnesses through equaling out the humors, your blood, phlegm, black and yellow bile. And everything was based around this humoral medicine. And if you look in this medicine chest here, you've got about 70 or 80 medicines so far that I've collected over the last couple years, and most of these are actually not really useful. Most of them don't do anything that's good for your body, but there are a couple exceptions to that rule. One of the most famous exceptions is quinine. And I have a sample of it up here. It's called cinchona bark, fever bark. And this does not cure malaria, but it treats the worst of the fevers. And to this day, in some places, it's still used. Another thing, herbalism, they used cinnamon and ginger and nutmeg to fight stomach upset. Today, we call that pumpkin spice. So there's some things that obviously could be useful, but most of 18th century medicine was quite damaging to the patient. A common misconception is that they would have, you would have died mostly in battle. Actually, the biggest killer was disease. So doctors did what they could with the limited knowledge they did, and at the end of the day, if they had some rum, make it a little easier on their patient after an operation is over. But beyond that, it was quite a hell on earth for anyone in a hospital, doctor or patient.